Happy Mother's Day. Today we're going to give you an update on the coronavirus and share the good news and the bad news. We will start with some good news. The vaccines are working, with the number of new cases in Cuyahoga County has dropped by 11% in the last week.
The bad news is that the number of deaths have increased in the same amount of time. This is not unexpected because the change in the death rates lags behind the change in the number of new cases. So hopefully we can expect the death rate to decrease in the coming weeks.
The good news is that the vaccine seems to work on the new variants of COVID-19, so the people who have received the vaccine are much less likely to get seriously ill or die if they become infected.
The bad news is that we have the new variants, which are mutants of the original. 5 are present currently in the U.S., and they seem to spread easier and quicker than the original COVID-19. The one that started in the U.K. seems to have an increased likelihood of being fatal if a person is not vaccinated.
The good news is the vaccine works, and 62% of people over the age of 65 are fully vaccinated, which means at least 2 weeks have passed since they completed their vaccinations. For Pfizer and Moderna, this means having received both shots, and for the Johnson & Johnson vaccine, it means since you received a single-dose shot.
The bad news is that only 32% of the general population have been fully vaccinated, and that people in the younger age group, specifically 20 to 49, are the sustainers of continued transmission of COVID-19 and seem more hesitant to get the vaccine.
The good news is the vaccine works, and vaccines are available to everyone in the United States, 18 and older, and the Pfizer vaccine is available to those 16 and older, and soon the age will drop to 12, which will be important as we consider what happens this fall as schools reopen. The vaccine clinics that take walk-ins are all over Cleveland, and there's plenty of availability for immediate vaccination.
The bad news is that vaccines are not widely available in other countries, and therefore there are surges of new infections and a huge increase in deaths in those countries, especially India. It's truly a terrible thing to watch the news and see what's happening there. And when any of God's children are affected, we all are affected.
The good news is the vaccine works, and that fully vaccinated people can start getting together with friends and family in ways that are safe. You can meet with others who are fully vaccinated without wearing a mask or staying 6 feet apart indoors or outdoors.
The bad news is that the variants seem to spread easily, and even if you have been vaccinated, you could possibly be infected and therefore spread the virus to others without knowing it, since you may not have symptoms. So it's very important for all of us to remain vigilant in protecting others by wearing a mask when around others who have not been vaccinated, or when you are traveling on planes, trains, or buses. And you still should avoid large indoor gatherings. Now, I want to tell a little story about my brother who had decided not to get the vaccine because he didn't want anything foreign in his body. So as we were talking about it, I suggested to him that he has to think also of his grandchildren. He wants to see his grandchildren, but they can't be vaccinated. As we said before, under age 12, kids cannot get vaccinated, but they can still carry the virus. And I mentioned to him if his grandchildren would cause him to get an infection because he wasn't vaccinated and he had a bad outcome, he got very, very sick or worse, died, how would his grandchildren feel? And so I think we have to all recognize that we're not in this just by ourselves. We affect other people. And we need to get vaccinated to take care of everyone.
So the last message we have for you is
get your vaccine.